Um, this week, let's see, I have some announcements to make. As part of the training that you did over this past week, you studied the lymphatic system, which is a system that helps to protect us from infections. If you're not muted, please mute yourself. The other thing that I wanted to put on the Google Classroom for you are the CDC's vaccine information sheets, the VIS. Anyone who has interpreted an appointment for a child, a pediatric appointment, is familiar with this type of sheet that I'm going to share my screen real quick and go to the classroom. Hang on a second here. So this particular information sheet is something that is given to anyone who has had any type of vaccine. And this vaccine information sheet is a sheet that explains what the vaccine is used for, what side effects it could have, what risks and benefits there are to this particular vaccine. So what I have done is I have posted to the classroom the vaccine information sheets. And the vaccine information sheets are what I want to show you in various languages. And so if you can see my my screen here, you'll see that there are 2 tabs on this particular website. It's one tab allows you to look at the vaccine list. So all of the diseases and things that they have vaccines for are named here, and you can click on any one. And if you haven't gotten your flu shot, then you will probably need to get one soon. And I'll warn you, this year it's a little bit painful. So anyways, they have these vaccine information sheets, and you can go on here and it'll give you all the information. It'll download a PDF form for you. The other thing is that you can look at this particular vaccine in different languages. Okay, so the vaccine information sheet, the VIS, is available in different languages for people. The other thing that you can look at is that you can go to the second tab, which has the language index. And the language index allows you to look up by language what sheets are available in that language. Now, the reason that this is good, say that you're a Punjabi interpreter, is that this will give you the terminology related to this particular vaccine. Okay, so you can click on it and you'll get a PDF of that particular information sheet. And then you can know what terminology will be used regarding that vaccine. Okay, so I just posted that. I forget if it was yesterday or today, so that you have it available for in relation to the lymphatic system. Okay, the other thing that you went over this past week was the endocrine system, and I'll talk about each of the systems a little bit later. I didn't post anything other than the hormones, but I'll explain that to you a little bit once we get in here. The other announcements that I wanted to make for this class is that, believe it or not, we only have like 4 more classes left, and so this course will be over next month, in December. And on the last day of class, I want to prepare you for what will happen on that day. We're not going to spend a lot of time going over new materials that day. But what I will be doing on that particular day is I will be reviewing what next steps there will be for you who want to go into interpreting, the credentialing, etc. And I have invited the person from the Oregon Health Authority, Edna Nyamu, to join us on that day to answer any questions that anyone might have regarding getting certified or qualified by the state of Oregon. I haven't gotten a response from her yet, but I will let you know if she's available to join us. She has done so in the past. Another thing that on that particular day, we are inviting representatives from a couple of the different local agencies to come and speak with you as a class to let you know what it is that an agency looks for when they are contracting an interpreter. Okay, so they'll tell you a little bit about their agencies and about how you know, their recruitment process or their onboarding process, and you can ask any questions also to representatives of those agencies. Lastly, on the final day of class, okay. Lastly, on the final day of class, this is something that we provide as a service for the students in the class, and it's not a required part of the class. So I have, excuse me for, I'm just a second, I have to respond to so anyway, on that particular day, after the end of the class, there is a gentleman from the Goodwill Industries of Oregon, and his name is David Lawrence. He's pretty fabulous, and he will come on that particular day, and he will do a 30-minute session on how to create an effective resume. Because you are self-employed, you are going to be you're going to be working with individuals, or you're going to be working with agencies that contract interpreters. Okay, and so in order for you to get signed on with those agencies, you basically need to solicit business from them. And so on that day, David is available. He will be here right after class. So at 11 o'clock in the morning, as soon as we finish the class, we will have David give a class on how to create a resume, and that is optional. So if you are good and you don't need to create a resume, you don't have to participate in that part of the class. And if you are, but if you're looking to sign on with more agencies and you want to reach out to the agencies, it's a good thing to have something to introduce yourself with. You know, that this is who I am. This is what my skills are. I have taken this class and I am ready to come and contract for you. And so he's an excellent instructor, and he will be working with you to help you prepare a resume. Okay, so like I said, that's optional. It'll be after the class is over at 11 o'clock. And David Lawrence from the Goodwill will be here with us that day. And then also another thing is that we have a workshop that is scheduled for the 12th of December, I think. So the week after the class is over, we have a class that is a workshop that is designed to help you prepare for taking the the national board exams. And so it'll explain, Daniel Hallberg will explain to you what next steps there are, what you need to do in order to get signed up with the board, the different boards, what are the benefits of each one, what are the pass rates for each one, so that you can make an informed decision about which board you want to get certified by. And then, and so again, that is completely optional. So that if you're going to be getting certified, this might be able to help you in preparing for the written exams and the oral exams as well. Okay, so are there any questions about what we're going to be doing the final week of class?
I have a question regarding the workshop. Will that have any cost, or it will be free?
There is a cost for the workshop. There is a $40 cost for our workshops and our classes. These are available not just to the students of this class, but also to the students, to anyone who is an interpreter and wants to prepare for that class or that workshop. Okay. Okay.
How do I? Oh,
Any other questions?
yeah, I have one.
Uh-huh.
So where is the workshop and how long it takes? And if we know the details, I personally can plan ahead.
Okay. Yeah. So the workshop is held online, and it is held from 1 p.m. to 3 p.m. and it's a Zoom meeting, just like the same way that we meet here. If you register for the workshop, you can register at the OHCIA website.
Mm-hmm.
And you register, you pay for the workshop, and then you'll be sent a link to sign on for that particular day.
Thank you.
Okay, any other questions?
When it will be that?
That, I think, Guillermo, are you here? That I think it was going to be the 12th of December, the week after the classes are over.
Yeah, that is, let me double check on that, but it is December the 12th. I'll give
December the 12th. Okay, yes. So, yeah, there's a lot of questions that are coming in about the final exam, and you can just say them out loud and I will address your questions, because I don't want to spend a whole lot of time. We have a lot to cover today, but I know that there are some questions, so go ahead.
Yeah, it is December the 12th from 1 to 4.
Okay.
And you're going to put this on the classroom, right?
Yeah.
Okay, perfect. Yeah, December the 12th.
Okay.
Okay.
Yeah. What are the questions about the exam?
I'd like clarification about.
Can you speak a little bit louder? I can't hear you.
Clarification about what you mean by a common pathology in regards to the final exam study guide.
Okay, so for each of the body systems, when we talk about diseases or disorders related to a particular body system, what's the word for pathology, or what does the word pathology mean? Who can tell me?
Condition or illness?
An illness or a medical condition that's related to that body system. Okay.
Thank you.
Mm-hmm. Other questions?
So for the final exam, are we gonna have to do it on that Saturday, or we're gonna have like a week like we did with the HIPAA one?
So the way that the final exam is that it'll be the same way as the HIPAA exam. Okay. Now I understand that there were some hiccups with the link or the to the HIPAA exam. I'm going to try to work that out because there were a lot of people who were able to take the exam without any problems, and there were some people who had hiccups. This is a good opportunity for us to see what challenges we might have and to make sure that when we take the final exam that there aren't any. So the final exam is a written exam. This class is taught only in English. It's not Spanish or English or Portuguese, or excuse me, it's not Japanese, Portuguese, Vietnamese, any other language. This class is taught strictly in English. So this information that you will be asked, you will answer the questions in English. Okay, there is no oral exam as part of this this exam. What were the other questions today? What does the test look like? I've already told you that. I've already told you that it is a combination of short answer, true and false, and multiple choice.
I want to ask you a question.
Yes.
If we don't pass the exam, how many opportunities do we have to take it?
So I don't like that sort of negative thinking.
It's not negative, but I freak out even over quizzes. So and it took me 7 times before I can pass with the state, before I can pass the license for my insurance agent. So I am so sorry. I failed it by twice.
Okay, so
I am freaking out over that. Sorry.
Can I record what here? Angela, what are you talking about? Can I record and post what?
The classes or the meetings that you having after the class is done.
Yeah.
The conversations.
I can do the one with the goodwill, but I can't do the workshop because it's a workshop. It's not a lecture type of training opportunity. It's something to work on. I think that so is the resume building one, but I'm not positive. So can you please release the dates in a document format, or are they posted on the Google Classroom calendar? I can post them on the Google Calendar. For what dates? Oh, I see. Okay. For the workshop. Are there opportunities to shadow interpreters in the field? Unfortunately, Sarah, because of the fact that there are HIPAA privacy laws, there is no opportunity to shadow interpreters in the field.
Can I speak?
Yes, of course.
Regarding that, okay. Jamay, one of your classmates last term, was able to shadow me last week. We had to ask the facility and we had to ask the client if it was okay for her to shadow. So one of the clients had no problem with it and to cancel, but she was able to shadow. So that was pretty exciting. I don't know, just thought I'd let you know.
Yeah, we have asked providers in the past, and we don't make promises about getting a shadowing opportunity because it is so hit and miss. And so we don't make those arrangements with interpreters or with providers. If you know someone who is an interpreter that you want to go hang out with and see if you can get somebody to let you into the clinic and a patient who will let you into the room with them, please do so. Take advantage of that opportunity, but it's not something that we set up for you.
Okay.
Okay. So what the final exam will be like? Okay, I thought it was high. Did we get a certificate? Yes, you had up until last night and to finish your HIPAA exam. Guillermo will be sending out your certificates this week if you had a passing grade, and I think everybody had like a 90, 80, I think was the lowest.
So I'm sorry, a little confused about that one, and I had also glitches. So would we have another opportunity or not?
Oh yeah, yeah. If you had some sort of glitch or there was some difficulty,
yeah, I thought I submitted it, and I was like, what?
okay, yeah, yeah. That's the other thing, is that some people thought that they just started the exam and then they didn't realize that they started the exam, and then they were gone for an hour, and then and the time ran out, and then they're emailing me and going, why can't I access the exam? You only get one chance. You don't get to come back in there and take the exam and then leave. Go, study some more, come back and try again. This is not the way it works.
I was freaking out last night because
Right.
I didn't know if I was gonna have another opportunity.
Oh, yeah, you do. This isn't, this isn't something that this class is predicated on. You're passing a HIPAA exam. The HIPAA exam is something that we do as a service to you so that you have your certificate before you're going out in the field to interpret. We're trying to get you as prepared as possible. So the language proficiency tests are something that is going to be required of you. We've made sure that you have that. Your HIPAA certificate is something that is going to be required of you, and we're making sure that you have that as well. And so,
so if I've seen those videos over and over many times, because in the past 10 years,
every year you get to have your certificate renewed. So yeah, that's
I know, but I know I've done it every year, but I never get a certificate, so I don't get it. I'm like a little confused over that. Sorry.
I would be confused about that too. Well, we will be sending you a certificate. I don't know where you've been taking your training from, but we will get you a certificate.
Insurance
Okay.
with the state and
All right.
stuff.
Okay.
Whatever.
Okay,
So I did email you the link to, Omar, I did send you an email with a link to the test. After you have watched the video, you were instructed to go check your email, or even the email says, watch the video, then come back and take the test, okay? What else here? Hang on here. I don't want to get caught up in all of this because of the fact that it's, we have a lot to cover today. Okay, so yeah, that's it for the exam right now.
There's one more question. She said you didn't answer if we passed it or not at this time.
Oh, I'm sorry. Yes, if you did not pass the exam, you have 70. You have to pass with a 70 or higher. And because there's 50 questions, that means that each question is worth 2 points. So you can pass, or rather you can answer 15 questions incorrectly and still pass the test. If you do not pass the test, you are given an opportunity to retake it. Yes. As far as how many times you can retake it, I think that the policy states that you can retake it once. If you don't get it by then obviously you still need to do some more studying, and you're able to either take the class again, which you would pay for, or you can come back the following quarter and retake the exam on with the test. So the exam will be provided as the same as the HIPAA. It was an online test. You have Saturday and Sunday to take it. You have to have completed your test by Sunday. Okay.
So only 2 days given.
Well, you'll have had 10 weeks of study, and you won't have, the term comes to a close on a certain day, and then, or the quarter comes to a term on a certain day, which is the, I think the 5th of December, and you have the 5th and the 6th to complete the exam.
So I have one more question regarding that. You sent us these study guides for tests, and there's so many pages, pretty overwhelming. And do we have to print it to make it easier than in study?
You know what, Ada, that's a personal choice. However you
Okay.
want to do that is your thing. I don't really care if if you print it, if you paint it on your wall, if you do whatever, you study however studying works for you. I can't answer that question.
Okay.
Thank you. Okay, so what we're going to do right now is we are going to go over a little bit about the lymphatic system and the endocrine system. So the lymphatic system, what is the function or the role of the lymphatic system? Who can tell me?
Prevent the body from infection.
Right, to protect the body from infection, okay? And so what type of infections can invade the body? What sort of outside things can invade your body?
Virus, bacteria,
Virus,
parasite,
bacteria, parasites,
fungi.
fungi, yes, okay. So yes, and then what are the major parts of the lymphatic system?
Lymph nodes,
Okay, so
thymus,
the body works through the lymph nodes, and what else?
thymus,
The thymus, yes.
spleen,
Spleen, excuse me, just one moment. Sorry. Okay, so the lymph nodes, the lymphatic vessels, the the thymus gland, the spleen, and there's one more.
The tonsils.
The tonsils.
Tonsils, yes, exactly. Okay, and so the body uses those to build up immunity to those types of infections. Now, what type of immunity is there? There's two types of immunity.
natural,
And acquired.
There is natural immunity, okay, which is also called innate immunity. And this is a type of resistance that you inherit from your parents. Now, we know that there's some certain demographic populations who are less susceptible to certain types of diseases. And conversely, we know that there are certain populations who are more prone to certain types of diseases. And so that is what we talk about when we talk about natural immunity or innate immunity. And when a child is born, it passes through the birth canal, and at that point, there is the immunity is passed along to the child. And that's why it's important to have natural birth, if possible, over a cesarean birth. The second type of immunity is called acquired immunity. Acquired immunity is where your body is trained to become immune to something, and so or there's something that helps to create immunity in your body, and so that's what vaccines are for. Okay, so the vaccines are there to make your body immune to something like the flu. So they develop vaccines so that you do not develop those illnesses. Okay. So what are some of the, I'm going to say the word, pathologies, diseases, conditions that are related to the lymphatic system?
Lymphedema.
Yes, lymphedema is what?
Edema in the lymph nodes that causes swelling.
What is edema? Edema is swelling.
Swelling.
Okay, So
It's
swelling
excessive
in the
accumulation of fluid.
second bed. So, right, it's swelling, which happens when there's an increase in fluids. Now, a lot of times people who have, breast cancer have some of their lymph nodes removed as well. And that will affect the lymph nodes that go down the arms. And so it builds it by disrupting the flow of the, imagine it's like cutting off a vein or something, that blood can't flow in and out the way it normally does. And so it builds up fluid, and then you get swelling in the arm. And so people who have breast cancer also often will type, as part of the treatment, will wear compression armbands or sleeves. That's the word I'm looking for. What is it? Actually, there was something really cool here in Portland over at OHSU. There was a doctor who developed just very recently a type of treatment that is a little bit like a bypass surgery that allows that to cut the lymph nodes and then to reconnect them so that there is a flow, and then that alleviates the edema. Okay, and that's kind of a cool thing, because that would be wonderful if that could happen. What's another pathology or condition related to the lymphatic system?
Tonsillitis.
Tonsillitis. It was very common some years back, or a few decades back, that pretty much a lot of the kids had tonsillectomies where their tonsils were removed if there was a lot of infections. And so now they have kind of cut back on the number of tonsillectomies that are done, and try to focus more on some antibacterial treatments, because it is a type of bacteria. Okay, what is another condition related to the lymphatic system?
AIDS.
Anemia.
AIDS is a wonderful thing, because AIDS is a very complex disease. It is a type of human immunodeficiency virus, which means basically it's something where the healthy cells are attacking, or the body's attacking its own healthy cells. Okay, so acquired immunodeficiency syndrome is the technical name for it, and it spreads through the entire body, and fortunately, we have a much higher survival rate now than we did when it first emerged in the 1980s, or 70s, I should say. So there is no cure for AIDS. However, it can be managed and controlled for a much longer life. So what else did you say? Anemia related to the blood? Yeah, so so in the blood, we talked a little bit about the role of the blood and the platelets, which help in the clotting process. There's also the blood cells are produced in the bone marrow, the red bone marrow, and then the component of blood in order to help with immunization, and antibodies and antigens that also help to protect the body's, or to trigger the body's immune system. Okay. What is another, okay, so anemia is a deficiency of iron in the blood, and that causes people to be weak. And that happens a lot of times with women who have lost blood due to irregularities in the menstrual cycle, or through pregnancy, etc., things like that. What is another pathology related to the lymphatic system?
Sickle cell anemia.
Okay, sickle cell anemia is a hereditary disorder also. It is very, it affects the Black population more than other populations. And again, this is a situation where your hereditary or your genes affect, can influence your body. Okay, so sickle cell anemia is another blood disorder, and where the cells are shaped like sickles or little moon shaped. Okay. Then that kind of has a buildup of mucus in your body, and that sort of clogs up your nodes. So what are, if, let's see, was that AIDS? We have AIDS. We have, if you have some sort of problem with your blood or your, like if you had anemia, or if you had sickle cell anemia, or if you had something related to your lymphatic system, what type of doctor would you go see?
Would it be a pathologist?
A pathologist is
Endocrinologist.
endocrinologist? No, because we're talking about the lymphatic system. An oncologist, if you have cancer, you might see a hematologist.
You can see a hematologist or a lymphologist too.
A lymphologist or a hematologist. Okay, and those would treat diseases that would be related to your immune system. The immune system, though, sometimes there's a whole class, you know, like AIDS, there's a whole category of diseases or that where your body attacks its own healthy cells, right? And
such as lupus.
Like lupus, like rheumatoid arthritis. And so though there's a type of doctor that treats those autoimmune diseases, and that is a rheumatologist. Okay. So, yeah, and that's kind of a fascinating area of medicine too, where, you know, for unknown reasons, your body just decides it's going to turn on itself. Let's see. So let's talk about the endocrine system now. Okay, the endocrine system. What is the purpose of the endocrine system?
Regulations of the body.
Hormone regulation.
Yeah, I want to hear from people who I haven't heard from today. So if you will unmute yourself, I'd love to hear answers from someone other than the few people who are answering all the questions, because they're going to pass the test, but I want everyone to pass it too. So let's see.
Controls the hormone level.
Okay, so Lydia, like you said, hormone regulation and control of the hormone levels. And so the endocrine system, even though our central nervous system, which is our brain, controls your body either in voluntary or involuntary muscles like your heartbeat, etc. It all comes from your muscles. However, there is say, for example, your brain tells your arm to move, or it tells you to go feed yourself. But the endocrine system, which to me, I have to say, I'm kind of a geek about it, is so fascinating, because the endocrine system tells your brain, hey, tell your arm to feed your mouth because it's time to eat. Okay, so it actually regulates a lot of your activities. Okay, and so I have this little booger here who is annoying as anything today, but he's 11 months old. He's not yet been neutered because I'm waiting for the bones to finish developing. So in the meantime, his hormones are starting to produce this urge for reproduction. Okay, and that happens to all of us at the age of when we start going through adolescence. You start getting certain urges, right? That's because those come from the hormones that are produced in your body. Okay, I put for you on the website a list of female and male hormones. For example, this is like what regulates so much of your body, so much of what you do. When it tells your body when to start menstruating, when to start, when to get sleepy, when to get hungry, when to go to the bathroom, etc. I did put something on the Google Classroom for you, and I'm going to just sort of, let's see if I have that up. Hang on, let me find it. The which is the circadian. I put it onto one of the website or one of the PowerPoint presentations, and it was the PowerPoint presentation on the endocrine system. And so I'm going to go to that one real quick, and I want to go and look at what we call the circadian cycle, the circadian rhythm, and so the circadian rhythm is something that tells your body what your biological clock is, what you should be doing at any given moment. Okay, and so it tells your body to go to sleep. It tells your body to wake up. It tells your body to, you know, everything that you do. So what you're seeing here on my screen right now is the circadian rhythm. The circadian rhythm starts on this particular clock at 12 o'clock noon up on top, okay? And so when you go towards the right at 2:30 in the afternoon, this is when you are at your peak, okay? You're in your very best condition. If you want to do something, keeping this in mind when you want to have the best performance. At 3:30 in the afternoon is your fastest reaction time. This is when your body reacts the most quickly. Okay. At 5 p.m. is when your body has the greatest cardiovascular efficiency and you are the strongest. So if you want to go work out and you want to really prove how strong you are, that's the time to do it. Okay. At 6:30 p.m., you have your highest blood pressure. And at 7 p.m., you have your highest body temperature. No, sorry. At 9 p.m., your body starts to secrete a hormone called melatonin. And that tells your body to start getting ready for bed, to start getting sleepy, right? So a lot of people who suffer from insomnia take melatonin supplements in order to induce sleepiness or drowsiness, because that's the body's natural signal that you want to go to sleep, okay? And then at 10:30 p.m., your digestive system says, okay, we're going to shut down for right now. I'm not going to have any bowel movements in the middle of the night. And then you go past midnight. At 2 p.m. is your deepest sleep. That is when you are most heavily into your sleep cycle. Okay. At 4:30 a.m., you know how you wake up and you're cold in the morning? Because at 4:30 in the morning, not only is that the lowest temperature for the environment, but it's also your lowest body temperature. Okay. And then at 6 o'clock, your body starts going, okay, it's time to wake up. Okay. So at 6:45, you have the sharpest rise in blood pressure. And at 7:30 a.m., your body stops secreting melatonin. And then at around 8:30 in the morning, it's most likely you're going to have a bowel movement around that time. Okay. And then at 9 o'clock in the morning is when you have the highest testosterone secretion. And then when you're the most forceful or most assertive or most confident, I'll say, especially the males because it's a male hormone. And then at 10 a.m., you have the highest level of alertness. So right about now, you should be like super alert. Okay, so this is the circadian rhythm. The circadian rhythm is completely controlled by the hormones that are secreted in the endocrine system. Okay, so that kind of gives you an illustration of what your endocrine system does. Excuse me a second. Okay, so like I said, the endocrine system controls your body, your biological system through everything. It controls how you grow. It controls how soon, how much you grow, whether you develop quickly or you develop at a slower rate, and it controls so much of your involuntary things that you aren't aware of. Okay, so let's see here. What are some of the more important let's see, you have 8 endocrine glands. Okay, it's important for you to know what those endocrine glands are. Okay, you need to know that those glands that secrete the hormones that rule your world, your thoughts, your urges in your body function, that they are the pancreas, the Langerhans, or the islets of Langerhans, excuse me, the pituitary gland, the pineal gland, the ovaries, the testes are both glands that control your life. The thyroid gland and the thymus gland all are working together to control your biological function. Okay, so know the 8 endocrine glands. That would be in your favor. What sort of diseases are there associated with the endocrine system?
Diabetes type 1.
Diabetes is, diabetes, when your body doesn't respond well to the hormones that are produced, diabetes can occur. And diabetes is something that affects all of your body systems, really. But it's sort of like cancer, but it originates in the endocrine system. What's another one?
Problems with your thyroid.
Problems with the thyroid, either overproduction or underproduction of your hormones. So hypothyroidism would mean what?
Did you say hypo or hyper?
Hypo.
Low.
Low production.
Yeah.
Yes. And then hyperthyroidism would be what?
High production.
Yeah. Overproduction. Yes, overproduction. Okay, so what else is a condition of the endocrine system?
Pancreatic disorder.
Pancreatitis or inflammation in the pancreas. Okay, I think we talked about sickle cell anemia. What about cystic fibrosis? It's another genetic disease. Okay, which also has, it's a sticky mucus, okay, that blocks the tubes in your pancreas. And so a lot of these things, people, they can do tests to know in advance. A fetus can be tested for some of this. The other thing is that as soon as a child is born, if there's something that might show an indication, or there's something in the heritage of the child, then there might be someone who would do some sort of tests. Does anyone know who that someone would be, or what the name of that doctor is?
Neonatologist.
Oh, good job. A neonatologist. Break that down for me. What does that mean? What's neo?
New.
New.
Mm-hmm.
What's nata? Natality.
Born.
Right, right. So birth, or, you know, the fetus. So a person who is, or an infant, right? So a neonatologist is a doctor who specializes in new children. They may be the doctor who may be seeing a male child because their testicles hasn't dropped yet, right? And if necessary, might have to do refer to surgery, but they're the ones who will be attending to children when they're first born. Okay. So I think that's about it as far as the endocrine system is concerned. I did post the hormones for you so that you have that available. And I just, like I said, I wanted to review with you what the circadian cycle was, just so that you could get an illustration of what we're talking about when we say that the endocrine system, or your hormones, pretty much rule your life. Okay, and it's because of those chemical messages that are being sent to your brain that then your brain sends out the message to everybody. Okay, so so this week we're going to cover something which is the digestive system, and we're also going to be covering the dental system. So the dental system, I don't have a there wasn't a training module in the program that we're using that includes the dental system. So I kind of took it upon myself to replicate it as much as possible using the same type of format. But what I want to do today is because there is no lecture that is associated with this, I'm going to just quickly go over the dental PowerPoint with you. And then afterwards, we're going to talk about what we refer to as interpreting equivalences, which is kind of a good way for those of you who are ASL interpreters, or who are interpreters of languages where they may not be the same words being used. So, or available. So anyways, let's take a break first. We'll come back in 10 minutes. Right now it's 9:55. We'll come back at 10:05 and we'll get started with the dental presentation. All right. Okay. So what I want to do right now is that I'm going to go ahead and do the presentation for the dental and I have a slide presentation. It's not a super long one, I don't think, but I want to talk about dental health. And so dental health is super important because it affects your general health as well. Okay, so the learning objectives for the dental health is to define, understand, and correctly pronounce medical terms related to the oral cavity, and to describe common diseases and conditions with an overview of various treatments related to the oral cavity. Okay, and the dental health is defined as the study, diagnosis, prevention, and treatment of diseases, disorders, and conditions of the oral cavity, which includes the dentition or the teeth, and the oral mucosa, which is the mouth around the muscles around it, and then adjacent and related structures and tissues, especially the maxillofacial, which is the jaw and the facial area. Okay, so looking at the mouth, there are several cavities, or rather looking at your face, your head, there are several cavities. One is the nasal cavity where your sinuses are located. And the other is your oral cavity where your tongue and your teeth are located. Okay. And then behind it are the pharynx, the epiglottis, the larynx, which is the opening into the pharynx, and then et cetera down to the esophagus. So the oral cavity, the function of the oral cavity is for eating, right? The front teeth are for biting, the back teeth are for chewing. It's for pre-digestion, so it starts to break down food before it goes into the digestive system. Your mouth is also used for drinking and for speaking and for breathing, because if you hold your nose, then you can breathe through your mouth. Your mouth is also used for infants to suckle, and it's an instinct that they're born with in order to feed. And your mouth is also used to help you make facial expressions, okay, like this little child here is doing. So the parts of the oral cavity include your cheeks, which are called the buccal fat pad. The purpose of the cheeks is obviously they're part of your mouth, but they also help to keep the contents of your mouth inside your mouth while you're chewing. You know, think about when you're eating and you're rotating food around your mouth. The mouth is located, the top part of your mouth is the hard palate. Okay, that's what divides your oral cavity from your nasal cavity. There's a soft palate, which is like a little curtain that comes down off the hard palate in the back. And that includes, where your tonsils are located. And that's also where the uvula is located, which is that little part that hangs down in the back. The tongue is part of your mouth, obviously, and then what's called the vestibule of your mouth, which is the entry point, that little space between your lower lip and your gums, okay? And then the gingiva, which are the gums themselves, okay? The hard palate divides the mouth from the nasal cavity, as I said. The soft palate is the curtain between the mouth and the throat. The tongue moves food around. It also, because that's where your salivary glands are, it produces the saliva, which is an enzyme that starts to break down food as you're chewing it up. And then your tongue also helps to move the food around in your mouth, and it helps to push the food back when you're swallowing. Your tongue also has the taste buds, which include sweet, salty, sour, and bitter, and it is used for speech. The other thing is that your tongue also expels toxins. So at night when you're sleeping, toxins build up on your tongue. It's important to get rid of those before you eat, because otherwise you're re-ingesting those toxins into your body, okay? Your gums or your gingiva are the tissue that surrounds your teeth, and they form a seal between the bone that holds the teeth in place and the teeth itself and the tooth itself. Okay, on the on the left side of this picture, you can see there's a healthy gum tissue. It's all nice and pink and it's all the way up. And then on the right hand side where there's tartar and there's bone decay, there's bone loss there because the gum tissue is all inflamed. So this is what happens when you have unhealthy gums and teeth. The teeth, or the dentition, are made up of two symmetrical arches. We have the upper arch and we have the lower arch. The upper arch is called the maxilla. The lower arch is called the mandible. The purpose of the teeth is to bite and then to chew. Sorry, I'm gonna, this is kind of taken on its life of its own now. So we are, as humans, have two sets of teeth. We have our primary teeth, which are the baby teeth, and they are deciduous. So just like the leaves are falling off the trees right now, they're called deciduous, off the deciduous trees. Those teeth that we're born with are intended to fall out at some point and will be replaced by our permanent teeth. Our primary teeth are made up of 20 teeth, and our permanent or adult teeth include molars and are 32 teeth. Okay. The first, the molars, the adult dentition, when we are fully developed, we have 6 molars, which are those flat topped teeth that are used to grind food down. There's the premolars, which are the teeth between the canines and the molars. Sorry. And then in the front, we have the incisors, which are sort of peaked, which are sort of sharp. They're used for cutting. They're used for biting. Think of biting an apple, okay? And then we have our canines, which are the 4 teeth. You think of werewolves, you think of canines, or you think of dogs have those big canine teeth, and those are between the premolars and the incisors. Okay. And then we have the wisdom teeth, which is the 3rd molar in the back. Those don't come in until we're about, in our around 19 to early 20s. And what often happens is that the teeth are all kind of aligned, and then when the wisdom teeth come in, the wisdom teeth may start to push the other teeth out of alignment. So we often have to remove the wisdom teeth. Okay. All right. So the anatomy of a tooth. The tooth is made up of 2 parts, the crown, which is the area of the tooth above the gum line, and then the root, which is the area of the tooth below the gum line. The outer part of the tooth is the enamel, and then that's the hard surface of the tooth. Then inside the tooth is the dentin, and then way inside is the pulp. The pulp is where it contains the nerves and the blood vessels of the tooth, and they go down into the bones and connect up with the rest of your circulatory system. On the root, we have the gum line, which is, we talked about that tissue, and then we have the bone that holds the tooth in place. Okay, that the soft part, which is the pulp, has down on the bottom is the root canal, and so that is the part where if a tooth is badly affected, you may need to have a root canal done, and that's where they go in and they drill into that part of the tooth to sort of deaden it or to clean it out. And that can be kind of painful from what I understand. Thank God, I don't know firsthand. So diseases and conditions of the teeth would include cavities or tooth decay, which is caused by a buildup of plaque or bacterial colonies, which have mineralized, and then they attack the teeth. And so that's, you know, when you go to the doctor and they examine you and they probe you, and then the treatment may include anything from fluoride treatment, even in children who have not yet developed any teeth, to putting in a filling and then putting in a crown and then doing a root canal, and if it can't be saved, to doing an extraction of the tooth. So you may be interpreting an appointment where any of those take place. The next one of the diseases and conditions would be gingivitis. Gingivitis is a gum disease that is a inflammation of the gums that is again caused by an excessive amount of plaque on your teeth, and then your gums get really swollen, and then they start to kind of decay. This leads to periodontal disease, which is where the gums aren't holding your teeth in place anymore, so they become loose, they start to bleed, and then you start having all sorts of problems with your tooth not being held on tight to your bone. Okay, and then that could actually help, or rather help cause to your jawbone and your teeth to eventually decay, deteriorate, and fall out. I hope I'm making a good case for good dental health here. Other conditions of the mouth or the dentition would be malocclusion. Malocclusion is where your teeth don't line up. Okay, it could be that you have an overbite, it could be you have an underbite, it could be that your teeth are off to the side or they're just crooked, and this can be caused also by either, you know, hereditary, that's just your mouth structure of your family, or it can be caused by excessive thumb sucking. So children who use a bottle for too long and they're sucking, or they're thumb sucking, this is why they encourage parents to discourage that, is because it will cause the child's teeth to get crooked. The way to correct that, of course, would be through orthodontics, or if the teeth are too crowded, then they would remove some of the teeth, or through surgery if there's an overbite or an underbite. Okay. Another disorder of or condition of the teeth would be an impacted tooth, where a tooth doesn't come through the gum line when it's developing. Okay, so this can help to cause your malocclusion, where the teeth are crooked, and it could also cause gum disease. Okay, so what you would need to do, obviously, for that would be to remove the tooth. Now, I don't know if you're aware, but if you have a trauma or an injury where you lose a tooth, you actually can put the tooth back in. There's 40% of children worldwide who suffer injury and trauma to their mouth, according to the World Health Organization. This can be either through an accident, through sports, or through violence. Obviously, the best way to prevent it is to use a mouth guard if you're participating in sports, you know, things like skateboarding and skiing and all that other fun stuff. But if you knock out a tooth, it can be reimplanted if you act quickly. So within 30 minutes to 2 hours, if you lose a tooth, put it in cold water and rush the kid to the dentist or to the hospital, and they can plant it in there, and it heals just like a normal tooth. Other conditions and diseases might be mouth sores or infections of the mouth, like a cold sore or a fever blister, which is actually, or there's oral herpes. So once you have the herpes simplex virus in your body, it never goes away, and that's why the cold sores come back. Especially they can be exacerbated if people are under a lot of stress and they tend to have that virus already in their body. Then that might reduce their immune system to where that might be where your stress comes out. So it's basically a herpes simplex virus. It's a form of HIV, or it can be caused by HIV. and that can be inside your mouth or around your mouth. People who have AIDS often have a lot of cold sores, and so there is some antiviral medication that can be taken as a treatment. Another disease would be oral cancer. Actually, 45,000 Americans per year get oral cancer. Don't smoke, don't chew tobacco. This will help to ameliorate your risk of developing that. Oftentimes there is no symptoms in the early stages, and so when you go to the dentist, the dentist may do a just a visual test. Oftentimes if you go to a dental appointment, the dentist will grab the patient's tongue and kind of move it around so that they can look underneath the tongue and all around the mouth to make sure that there are no signs of oral cancer. Another condition would be a cleft lip or cleft palate. It's when there's the body didn't develop the facial structures correctly when it was in development, and that requires surgery in order to correct it. And it can be a unilateral cleft lip, like on the left side where it's only on one side, or it can be bilateral. Okay, two-sided cleft lip, which is on both sides of the mouth or the cleft palate. Okay, another condition is one that you guys actually did a practice session about, which is temporomandibular disorder, or TMD. This is where people sometimes have locked jaw, or they clench their jaws, or there's just inflammation of the jaw bone where it meets the bone, the skull bones, and so that tension actually creates painful headaches, or it could be that you have clicking at the point where your jaw comes together. Okay, there's treatments for that either through medication for muscle relaxers. You can get a bite guard through your dentist, or you can do physical therapy to ameliorate that as well. Specialties related to the dental field would be endodontics, which is treatments for pulp disease. There's oral and maxillofacial radiology, which obviously deals with facial cancer or mouth cancer. There's oral and maxillofacial surgeries, like, you know, if there's a cleft palate or something. There's orthodontics and dentofacial orthopedics, so doctors who work with your teeth themselves. There's specialties around pediatric or geriatric dentistry. So for either children or for older people, they have their own special sets of problems. Pediatric, if you go interpret at a pediatric clinic, they often lay the children down rather than sitting them. They may have support dogs. They may have, there was a case one time when I went to a pediatric dentist where they actually had to remove all the child's teeth because they had been neglected so badly that they were damaging the entire mouth. And so then sometimes if they're doing any sort of treatments, they'll just put the child to sleep rather than working on them awake because they want to reduce trauma. Periodontics is, you know, what you would do to go to a root canal treatment or something like that, where you're treating the supporting structures around the mouth, around the teeth rather, the gums and the bones and the tissues. And then there's prosthodontics, which specializes in prosthesis for dentals, like what you see in the background picture here, which is a tooth implant. Okay. So the reason that it's important to focus on dental health is because of there is a correlation between dental health and your overall health. It can affect endocarditis, which is an infection of the inner lining of your heart. It occurs when a bacteria builds up in your body, regardless of what part of your body, even if it's your mouth, and that spreads through your bloodstream. The same that you know, with cardiovascular disease can be affected by oral bacteria. In pregnancy and childbirth, periodontitis has been shown to affect a child's birth weight. So they may be born at a low birth weight. Other conditions that may affect your dental health would be if you have diabetes, you are more prone to gum disease. If you have diabetes, if you have AIDS or you're HIV positive, you may have a lot of like cold sores or mucosal lesions, as they say. And then if you have osteoporosis, it causes your bones to get weak and brittle, and that includes the bones in your teeth, okay? And then if you have Alzheimer's, people who have Alzheimer's have poor dental health because they just sort of forget to take care of their teeth. They don't, they neglect their own well-being. So it's important to practice good dental hygiene. And you'll see on this picture, this is a really good illustration. When the baby's teeth start to come in, it's always the bottom two teeth come in first. Later on, the upper two teeth come in, but there's a whole series of development of the teeth as well. So it's important to brush your teeth at least twice a day, floss daily, eat a healthy diet, limit the number of snacks between meals, replace your toothbrush, right? Your toothbrush, especially if you have infections, you're getting those infections on your toothbrush, and then next time you brush your teeth, you're reinfecting yourself, okay? Go to the dentist twice a year to get your teeth cleaned and have regular checkups, and avoid things like sugary drinks and tobacco and all that other good stuff. So that's what I have to tell you about dental health. And I will post this for you also on the Google Classroom. And as well, I have posted a whole section on dental terminology, terminology related to to dental care, which you may find useful if you are interpreting in dental appointments. Please review it, include any terms that you aren't familiar with in your personal glossary. All right, so I'm speaking really quickly. I apologize to Jennifer, our interpreter, and to anyone who's trying to keep track of what I'm speaking and saying. But now what I want to talk a little bit about is interpreting equivalences. So begin by a quote from the IMIA about this in the standards of practice that says that interpreting, the most basic task of the interpreter is to transmit information accurately and completely. Therefore, the interpreters must operate under a dual commitment. Number one, to understand fully the message in the source language. And number two, to retain the essential elements of the communication in their conversion into the target language. So interpreters whose linguistic proficiency in terms of the breadth and depth, right? How much and how deeply you understand both languages is high, and who have a solid working knowledge of the subject matter are more likely to be able to make the conversions from one language to another without needing to ask for much clarification. Those whose linguistic proficiency is limited can use appropriate strategies to ensure that they themselves understand the message before they make the conversion, and that all the pertinent information has been transmitted. Therefore, the reality is that language is something you have to be able to understand. We've talked about register before. Are you speaking in slang? Are you speaking in formal language? Are you speaking, in idiomatic expressions, etc.? And so a lot of that has to do with culture. And another quote is that there's a cultural interface. Language is not only the element at work, is not the only element at work in the interaction between providers and patients who speak different languages. But the meaning inherent in the messages conveyed is rooted in culturally based beliefs, values, and assumptions. According to linguists Worf and Sapir, language is an expression of culture and the way that the culture organizes its reality. And we'll talk more about culture another day, but the interpreter therefore has the task not only of knowing the words that are being used, but of understanding the underlying culturally based propositions that give them meaning in the context in which they are spoken. Interpreting in the healthcare arena requires the interpreter to understand the ways in which culturally based beliefs affect the presentation, the course, and the outcomes of illness, as well as perceptions of wellness and treatment. If the provider and patient share similar assumptions about medicine and its positivistic scientific principles, it's more likely that the interaction will go as smoothly as if they were speaking the same language. Okay. In such cases, the interpreter simply has to make the conversion from one linguistic system into another. The problem happens, though, when there are dissimilarities in the assumptions. Okay, and then you might want to interpret something literally when maybe the meaning is not a literal meaning. Okay, or that you believe that there's a word that has a meaning and that meaning is not exactly correct. Okay, so sometimes we run into what we call untranslatable words. Okay, and what are untranslatable words? To quote from the IMIA, untranslatable words represent concepts for which a comparable referent does not exist in the society of the target language. Okay, for example, the concept of bacteria, a living physical organism, is not visible to the naked eye, is a concept that no equivalent exists in many rural parts of the non-literate society. So in order to get the concept across, the interpreter might have to work with the provider to find ways to transmit that information behind the concept. Okay, so you as interpreters may not always have words in both languages to convey the meaning, and then what are you going to do? Okay, the first thing is that you need to fully understand what's being said. Okay, and this is the reason that the Oregon Health Authority requires that you prove your language proficiency. Okay, and you identify the cultural language, right? So if, for example, when I speak in culture, I might be saying American culture, but maybe I'm speaking about a different type of culture, like based on the register, it might be hip hop culture. If somebody is speaking using hip hop culture language, are you going to understand what they're saying and be able to convey that message exactly in the language to which you interpret? Okay, those are the challenges. Okay, and so a lot of times English, I've said this before, I'll say it again, English is a very lazy language, and there's a lot of underlying assumptions that maybe I know when I'm interpreting to Spanish, I have to add more words because in English, there's assumptions where in Spanish, I have to say what it is we're talking about. We say it, do it, just do it. What are we talking about, right? And so if the patient tells the patient, the provider tells the patient, you know, bend it, or no, here, we say switch, okay? A lot of times I'll be interpreting physical therapy appointments and they'll go, okay, switch. Right, I have to say, okay, now switch arms. Or I went to a mammogram yesterday. Okay, now switch. Okay, now take your arm out of the other sleeve, right? Because in English, all they said was one word, switch. And I have to convey that meaning in a language that doesn't do shortcuts that same way. So I have to say switch arms. Okay, so there's a lot of assumptions in English. Also, like I said, register. Use, what register or what type of language are they using? Is someone using slang? Is someone using profanity? If someone says the word, oh, he's just a big, pardon my French here, but I'm going to say, oh, he's just a big asshole. Well, how are you going to interpret that term? How would you say that in your language? Okay, are you going to say the literal meaning? He's just a big anus. Well, that just doesn't seem to have the same meaning as when someone is insulting someone by using the term asshole. Okay, so what you have to do then is derive the meaning of what's being said and take that meaning and then find an equivalent term in your own language that would get that message across by conveying that message. Okay, so focus on the meaning of what's being said is basically what I'm trying to say. So an equivalence is sameness, right? Making the same meaning from this language to this language, even if it's not using identical words. Okay, we have to look at our assumptions, and so there's ways that we think of prototypical things. For example, if I'm talking, I give the example of cheese. If I say I love cheese, and I'm thinking as an American, I love cheese, I'm thinking brie, or I'm thinking, some yellow cheese, government cheese, or whatever they call it. And the person who is listening to my term may be thinking cheese in a whole different way as what I'm saying. So we have to understand that the culture that we exist in helps us to define the words, okay? And so we have to make it very clear what it is that we're talking about, okay? And so when you find that there's no equivalent in the other language, what you need to do then is that you have two strategies. Number one, you can define it. Okay, and this is what I was saying. This is very important for the ASL interpreters, because the ASL interpreters may not have a word in that other language for a medical term, but you can define that term. Okay, so you can say hypertension, and then you can say high blood pressure. Okay, if there is a term in your language, I encourage you to use that term. But if there is no term, then you can use a definition of the term. The second thing that you can do is you can describe it. Okay, that's the second strategy that you can use. So if you don't have a term in your language, you can describe what it is you're talking about. Okay, or you can explain it. You can explain, well, hyperthyroidism. Well, hyperthyroidism is when your thyroid is overproducing the hormones that it should be, and then explain the consequences of that, right? If necessary, if that's appropriate. If not, you can just leave it at that. You can just say, you know, based on my knowledge of medical terminology, I know that hyper is too much, and thyroidism is so your thyroid is producing too much. Okay, we know that it produces a hormone, so we can say it's overworking, right? Based on our knowledge of medical terminology. So the other thing that we need to know is that we often communicate without words. Okay, nonverbal communication is part of our communication. Okay, it's sharing information without using words. It's by using gestures. It's by using the movements that you're making. If I'm the pose that you're standing in, how quickly you're walking, or where you're looking, and or what your facial expression is. Okay, so you're actually if I'm making a facial expression like rolling my eyes, I'm saying something. Right? And so we have to be very conscious of the fact that we are speaking with our body at all times. Okay. The function of nonverbal communication is to express our attitude, our inner state, our personality. Sometimes it'll kind of show how truthful we're being, right? So they say if you look to the right, you're if you look to the right, you're lying. If you look to the left, you're thinking, or vice versa, one of the two. So your body is speaking without you needing to say anything. The quality of your voice, if you are angry, you might, or speaking sarcastically, like, you know, like a husband and a wife are arguing and the wife says, "That's fine." Well, that's fine, right? So the tone of your voice is saying something. And if you are an ASL interpreter, you know that you have to describe the tone of the voice in order to get the message across as well. Okay. So nonverbal communication often works concurrently with spoken language. Okay. It works at the same time. You might be speaking and you might be gesturing and, you know, blah, 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 blah. And so that is a way that you're working to speak and communicate with your body at the same time. Sometimes your body language might replace your verbal language, right? I know that as a child, if we were over at somebody's house and we were misbehaving, my mom, all she had to do is give us the look, right? Or go, mm-hmm. And we knew, like, oh boy, we're in trouble, right? We're going to get it when we get home. So she never had to say anything, but we knew that just wait till you get home. And so many other things that people say, or you go to a restaurant, you ask for the check, or, you know, you might do a little hand signal or something to indicate, please bring us the check. So there's ways that we can communicate without ever having to say anything. And this can be, you know, this is very common in Latin America or in other countries to ask for the check. And that way it's not so common here in the United States. So it's actually influenced by culture as well. Or it could be that, you know, like in the case with my mom, that was just a family thing, right? Or you might just have a group of people that you might have that code for. But just know that nonverbal communication is always present in everything you do. Whether we like it or not, it's how people will judge us. So if you are standing in an appointment, I'm going to stand up for a second. If you were at an appointment and you're standing like this, you're saying something, right? You're saying that's some sort of aggression pose. Men will oftentimes sit like this. This is sort of a dominance pose. So there's all sorts of ways, and know that you will be judged based on the way on the messages that you're sending out, right? If you are sitting there and your arms are crossed, your feet are crossed, you're like shut down completely, that's saying something, right? So just be aware of the messages that you're sending with your body. As interpreters, know that it will affect the outcome of the session. If you're standing there looking very aggressive like that with your hands on your hips, it might intimidate someone that maybe they aren't feeling as comfortable about speaking as they were before they came in with you. Another thing is that if the interpreter is hesitating too much when they're interpreting, or they spend too much time thinking, or if they're saying, huh, well, you know what, that makes the person listening to your speech wonder if you really know what you're saying, right? So it takes away any confidence they may have in you. So know that people are going to respond to you. They'll respond to you by the way about the way you look, about the look on your face, about your posture, about the way you're dressed, about the gestures you make, etc. Everything is transmitting a meaning. Okay, so just know, and even if you are interpreting over the phone, know that when you're interpreting and you are smiling, that smile, that tone in your voice comes through. Okay, so just be aware that of nonverbal communication, as well as the communication that you are actually speaking. Okay, but I gave you an interpreting practice session that is going to be a little bit challenging for you, especially those of you who are not native English speakers, because I want you to understand that that sometimes understanding what you're hearing can be a little bit challenging, and there's all sorts of assumptions, and in this particular exercise, and so it's kind of a fun one, and you'll find it challenging. And then there's some questions along with that exercise as well that I want you to answer about that. The other thing I want to comment about, though, in interpreting is the fact that we have to be very careful about interpreting when we think that we know a word, or that false cognates. Okay, and a false cognate is when you try to interpret a term in in what sounds to you like it should be the correct word in the target language. And so a classic one in Spanish is the term embarrassed, right? And that particular term, embarrassed, if you try to say that as in Spanish, embarazado, then you actually are saying pregnant. So a lot of times, especially younger girls who go to Mexico or to go to Latin America, and they're speaking in Spanish, and they're like, "Oh my God, I'm so embarazada." They're thinking that they're saying "I'm so embarrassed," but they're really saying "I'm so pregnant," right? And so be careful of false cognates. Another one is the term, and I will caution you as a Spanish speaker, the term actually. Okay, we use that a lot in English. Well, actually, I haven't done that before, but I've done blah, blah, blah. But the term actualmente in Spanish means currently. Okay, so if you're asking the patient, are you currently taking that medication? You would say, are you actually taking that medication? If you're using that word. And so be very careful about using the word actually correctly in Spanish. There's other false cognates. There's a whole bunch of them. Another one that I hear a lot when I'm interpreting is the word agarrar, which is to grab onto. right? And so for example, I went to an appointment this week and the medical assistant said, I'm just going to take your blood pressure, but because English is so lazy, we say get. I'm going to get your blood pressure. I'm going to get, and it's not like I'm going to check or I'm going to take it. We just use a word because it's easy to use, right? And we overgeneralize that word. But in Spanish, if you take that word and you say it literally, I'm going to grab onto your blood pressure, it doesn't make sense, right? So you can't say, I'm going to agarrar your blood pressure. It would be, le voy a checar la presión, le voy a tomar la presión, I'm going to take it, I'm going to check it, whatever. But be careful about using words correctly because it can change the meaning of what you're trying to say, okay? What's another false cognate? God, I had a whole list of them.
Mary, I have, I don't know if it's one of them, but squeeze is a word that I also get mixed up because when the provider says squeeze my fingers, it's apachurrar o apretar.
Crush. Apachurrar is crush, like smash my finger, right? I would say apriete mis dedos, right? Squeeze my fingers.
Because I've seen actually, like if you look for squeeze in the dictionary, it'll say exprimir. That's what I've seen. So obviously,
yeah. Exprimir is like to wring out.
Yes, yes. So I'm not gonna tell them to do that.
Okay, that's a good one. Words, other words that have similar sounds but different meanings. Yeah, just be cautious of that. Just be very cautious of making sure that you know the meaning of the word in that language when you are using it. And be careful about using idiomatic expressions. Sometimes, a medical provider will say some expression and I'll just be like, oh my gosh, what, how do I say that? Because, they've used some term that is, doesn't really make sense in Spanish. And then what I have to do, like I said, is I have to look at what is the meaning of what they're saying. What are they trying to say by using that expression? And then how can I find a similar expression? I used the example of asshole, and I'm sorry, that's offensive, it's profane, but we run into profanity in our appointments. And so, maybe there's an equivalent term, and that equivalent term has nothing to do with any anatomical part of your body, but it has the same force, it has the same insult inside that term. Okay, and that's what you would look for, is an equivalent term, so that you are delivering the message, even if the words may be different. Okay, Claire, tell me why you're always careful with positive test results.
I'm careful with that because in sign language, signing a plus can mean like a good thing, or it can mean we're confirming that you do in fact have something. And sometimes a positive test result is not a good test result.
That's brilliant. That's brilliant. So positive could be, this is a positive thing, right? And so, but the positive test result is a negative thing. It's a bad thing, right? And so I get what you're saying. You have to be very careful about delivering that message that you're trying to deliver, rather than maybe saying the exact words. That's a wonderful one. Great example.
Mary, I do have another one. It's like scheduling, or the scheduler or the scheduling department, because when, the provider said, well, we're going to schedule your next follow-up appointment, we'll say, vamos a agendar su próxima cita. But how do you actually say the department or the scheduler? because sometimes like the provider will say the scheduling department will call you to schedule an appointment, or the scheduler will call you.
How would you say, I'm the scheduler or I'm the scheduling department? Is that what, I don't understand your question.
I mean, I'm not going to be a scheduler, but I'm going to tell the patient, the scheduler will call you, or the scheduling department will call you. That's kind of, I mean, I try to say the receptionist or something, but is there an actual term?
I don't know. As I've heard the word coordinadora. So the coordinator of the, whoever coordinates the appointment. But generally, and it's something like that, I'll just say, the clinic will call you.
Okay.
I said coordinadora, but generally, I'll just say, well, the clinic will call you to schedule an appointment. They don't need to know exactly, what the title is of the person who's going to be calling.
Okay, so even if the provider says the scheduler will call you or the scheduling department will call you, I can just say the clinic will call you?
Yeah. Yeah, because that's really what they're saying is, somebody here is going to call you. Unless they're like specific to the name of the individual, then obviously that would mean, well, you need to speak with this particular individual. And it could be there are 17 people in the scheduling department, but we want it to be Beatriz to speak to you. So then you would, of course, just say the name of the individual, but otherwise you would
Mary?
just say whoever.
Hi, this is Pa. Yeah, another thing too about that scheduler is sometimes the doctor may refer them to a specialist or something like that. Then I think in that case, then we can say, the heart doctors or the, heart clinic or, X-ray or MRI going to call you to schedule an appointment after they get approved by, insurance or whatever. But I think that, specific, but yeah, many times I just say they will call you from here and I clear that up, but yeah.
Mm-hmm. Yeah, right. Because it's, the important thing is that you are getting this message across that somebody is going to call you, right? If it's like if it's a specific individual, you would name the individual. But if it's just a generalization, like someone from the specialist office, so the orthopedic surgeon will call you, or the lab will call you with the results or whatever, then you can just say the lab or the clinic or whatever. So yeah, focus on the message. Don't take too much liberty with interpreting things, and make sure that when you're interpreting, you are relaying the content of the message as well as the register of the message. So if they are speaking in profanity, you need to speak in profanity. And I am so sorry for those of you who feel that that it's your job to censor because you don't like the words they're saying. You're not their mouth. You are speaking the words for them. Okay. And so if it's someone who is speaking in a very high register, then you must maintain that high register, and you must find equivalent terms in that high register. And if they're speaking low register, then you have to find the equivalent terms in the low register as well. Okay, so that's why I read that quote for you, because these are the standards from the International Medical Interpreters Association. This is what you're expected to produce, is that language that is being said has to be transmitted into the target language. Okay, all right, we've kind of run out of time. I will post all the information about the classes that we have, the workshop for the for after the course is finished. And then just know that on the final day of class, we will have representatives from different agencies come and speak to you. Hopefully we can get Edna Nyamu from the Oregon Health Authority to come and speak with you. And then after the class, it's completely optional, and that's why it's after the class, that David Lawrence from the Goodwill will come and join us on help you to prepare a professional resume. Okay, so your class, or rather this week, like I said, will be the digestive system. There is homework only in the digestive system. There is no homework on the dental system. And make sure that you answer the questions on the interpreter practice session. Okay. All right. Thank you all so much for your time and for being here today. And have a wonderful weekend. I'll see you next week.
Thank you.
Mary. Thank you all.
Bye.
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 Muchas
Thank you, Mary.
gracias.
If you have questions, you're welcome to stay after, of course.
Hi, Mary. You know, I did do the interpreter practice, but then that's really kind of like confused how to submit that. I practiced it with Nima.
So the only reason that I assigned that is because that's the only way that I can say this is an assignment for you. Okay. But I think that at this point, you don't need to say, well, I learned this, or this was hard, or this was easy, or but I need to assign it so that you know that you have to do this. And then, you know, you can simply just say submit, but not submit anything.
Okay.
Although this week I do want you to answer the questions. So you will be submitting, and I think I'm going to have you do the questions in the future so that there's no confusion. But
okay.
Yeah, just submit it like you normally would any other homework.
Yeah, I think I tried to submit it a couple of times and I was a little confused because then I'm kind of like, do I re-download it and then I need to make a remark on it before I turn it in again, or because the form is different this time from this time.
Yeah. I think that it will be easier this week. Try that. If you have any questions, let me know. If you have any problems with it, let me know.
All right, thank you.
I want to ask the same. I did the interpretation, but I didn't submit it because I was reading. They said you don't need to submit this, so I didn't submit. So I was like, oh. Yeah. And the other question what I have is about HEPA. I know I sent you an email and you respond to me, but I saw just videos again, and I was like, oh my gosh, what I'm doing wrong? I couldn't see.
Yeah, I don't know what happened with the link between the HIPAA, the test. So there's two different programs. One is that runs the camera that says, okay, it's shutting off. And the other one, it says, okay, what test do you want to administer? There was some sort of break in the link between the program that administers the test and the test itself. And some people had no problems with it. And some people, like with you, I was emailing late into the night going, all right, I'm done. I just can't do this anymore. So, I will send you the test. If you can't get it done, I will send it to you as an email, and then you can send it back to me and I can grade it manually. But yeah, don't worry about that. If you weren't able to do that, just let me know.
Yeah, Mary, this is Omar.
That's Omar.
Hi, Mary. Yeah, it was about the HIPAA actually, and I was not sure how to do it because I got an email with two videos, which is one part one and part two.
No, you got that. That wasn't an email. That the video. Okay, so the HIPAA on the Google Classroom, there is the HIPAA segment, just like all the other classwork, and
okay.
And then it had the videos as part of that, and it said separately you will receive an email with the test, and then that email said, here's your test, click on this link, and then it was supposed to take you to the test. Some people, for some reason, it didn't open the test. even though it had the timer showing that and I knew because I can see that they did make an open the test, but to me it showed that they opened the test, and then to other people it showed and then to the person it never actually opened the test. And that's what I'm saying, that was the link that was broken in there. But it was that test, you did receive an email with the test on there.
Okay, because I was checking in my email inbox and I couldn't see anything yet, like the link for the test. I haven't seen that yet. So I guess that.
Yeah, I sent it to the entire class last Saturday. So you should check your emails for last Saturday. Check to see also, it might say that it came from a program called Quilgo or something like that.
Is something that I got that I thought it was like an advertising.
Okay, we'll look at that.
It says like, you are invited Soon Phone 101. Is that one?
No, not about Zoom.
Oh.
Yeah, no. It was something, it may have said that it came from Quilgo, but anyway, just go through, it should say HIPAA test on it, or HIPAA exam. So look for something that has like as a subject line, something about the HIPAA exam. But if you don't, let me know, I'll send you a new one.
Okay, well, all right. I will go through it.
I'll check,
okay.
I'll check to make sure that you sent it, or that rather that that I sent it, although I sent it to the entire class, so there's no way it would have excluded anyone. But
yeah, what I have in my email inbox is this email, and where there are 2 videos here to watch. That's what I'm looking right now.
Huh. Okay. All right. Yeah. Yeah. If you don't have the test, I'm going to send you another one regardless. I'll just go ahead and send you another test email.
Thank you, Mary.
All right.
Mary, just one more thing.
Yes, Omar.
You know, when we were practicing, and my partner is Sarah, so we practice every Thursday. So I realized that doing this interpreting thing and taking turns and waiting for the person to say, let's say, to read a paragraph and then you interpret it, and it takes like longer and it's a little bit difficult instead of doing it like how can you say this at the same time that the person speak.
Okay, that's because you're talking about 2 different styles of interpreting.
Yes, so I find it easier do it, you know, at the same time that speak. Can you do that actually or not?
Okay, I understand what you're saying. For some people, simultaneous interpreting is easier than consecutive interpreting. However, as a class, we are studying consecutive interpreting. And actually, if you find that consecutive interpreting is harder, I kind of like the idea that you practice consecutive interpreting so that even though it's uncomfortable, that you get better at it, because it's what you're going to be doing mostly in appointments. Okay, there are times when you will be asked to do simultaneous interpreting. There's costs and benefits to each, and I think I've talked about both, and we're going to practice some simultaneous later in the course. But the hard thing about consecutive interpreting is that you have to remember everything.
Yes. Yeah, that's exactly what I'm talking about. This
the person is speaking and you're holding it in your little shot glass memory, and you're like, oh my God, my memory is starting to overflow. Okay, stop. I have to dump out that glass, and then you can go ahead and fill it up again. And then it's okay, it's running out. And so what, that day that we were talking about memory, one of the jobs is to grow that glass so that you can hold more before you have to empty it out, right? So developing your memory skills is crucial to interpreting, okay? Because this is how you're going to be tested, is and how you're going to be doing most of your interpreting is consecutively, okay? So you have to hold everything that they're saying, and then you can go, oh, okay,
I know.
Right?
The thing is that, yeah.
Because you are having to work your memory. Now, what you're talking about is simultaneous, and like I said, one day we're going to be studying about simultaneous. The good thing about simultaneous, it's not like a shot glass, it's like a colander, right? And you're pouring something in, but it's not staying in there, it's pouring out the bottom, right? And so you don't have to have good memory skills to be a simultaneous interpreter, because you can just go into autopilot and keep talking and talking as they're talking. And just the problem with simultaneous, however, is that you're not doing the 3 steps as 1 step, 2 step, 3 step. You're not saying, I'm receiving the message, I'm converting the message, I'm delivering the message. Okay, those are the 3 steps of interpreting that I've talked about, right? So the reception, the receiving the message, processing the message, rendering the message, okay? When you are interpreting simultaneously, you are receiving, processing, rendering, receiving, processing, rendering, receiving, processing, rendering, all at the same time, over and over and over and over and over and over. For some people who are new to interpreting especially, that is greatly overwhelming, okay? And so, and that's something that we do, but we don't do it as often. Like yesterday, if you go on Facebook and you go to OHA in Espanol, has the Oregon Health Authority has a Facebook page called OHA in Espanol. Follow or like or whatever it is on that page, and then you will get updates every Friday. The governor gives updates on COVID. And during those press conferences, those updates on that Facebook page are done in Spanish. That means that somebody or a couple of somebodies are sitting there interpreting the governor's update, and sometimes conversations or question and answer sessions with other individuals. And so, so if you go on to that website, you'll hear the people who are interpreting simultaneously, and you'll hear what that looks like. You'll see what that looks like, okay?
Okay.
Check it out. OHA en Español is what it's called.
OHA en Español.
The Facebook page, and then on Friday, I don't know, midday or something, listen to, they'll let you know, okay, they'll say OHA en Español is live now. And I think that they have actually recordings of all the previous ones too. You can go on there and listen to what it sounds like when someone is doing a professional simultaneous interpreting.
Okay.
All right.
I will check it out.
All righty. Okay.
Thank you, Mary.
Thank you, Omar.
Mary, I do have a question. When it comes to interpreting prescription drugs or medicine, can we say the exact medicine word, or is there a different, like for example, Lamisil, you need to take Lamisil. Can I say Lamisil, the same word, or is there a different meaning in Spanish?
No, you can say the same word, unless it's a common word like, aspirina. You can say aspirina instead of saying you have to take aspirin.
Mm-hmm.
Right?
Okay.
Or or guess that's what are you taking? I'm taking ibuprofeno, right? And so you can say ibuprofeno. I mean, people understand the common terms, but if it's like a proper name like that, you can just say the proper name in English, right? It's like if you were trying to interpret someone's name from Mary Bell to Mary Bell, right? It's still the same name.
Okay. So, okay. Because sometimes, there's big words And I'm like, okay, do I have to say it in Spanish? Is there a definition in Spanish, or can I just say it the same thing?
No, it's the same thing because it's a proper name.
Awesome. Thank you so much.
All righty. Good question. Other questions?
I got the HIPAA exam score released, but I couldn't open it. The result?
Your test itself?
Yeah, I did the test.
No, I know I'm saying, but I mean, like you got your test result and then you couldn't
Yeah,
open the test to
I
see
couldn't.
if you got right or wrong?
Yes, yes.
That's an interesting question. I'll look into that. I forgot how that works. Okay, HIPAA exam test results. Okay. I'll look into that because I know that it releases the results, but I don't know how it releases it. I just, I have an option where it says, do you want the students to get the results back right away, or whoever took the test to get the results back right away? And I just say yes. What that looks like, I don't know, right? But I will go and look at it and
It says view, but when I open the view, you need permission, it says.
Okay. All right. I'll look at it and then and see what I can do to get there.
Okay.
For you.
Thank you.
Thank you. Veronica, do you have a question? Nope. Ina, do you have a question?
Oh, no, I was just asked you about the HIPAA, like just a HIPAA certificate on 2018. I had it. I still have to go through to the exam.
Yeah, because you're supposed to get a new HIPAA certificate every year. So if yours is dated 2018, you'll be doing yourself a favor because somebody's going to say, hey, you need a new HIPAA certificate, and then you'll have to take it, and then you'll have to pay for it. And so you'll actually be doing yourself a favor by just doing it now and not having to pay for it.
Okay.
And then you'll say, I have a 2020 certificate. Ha.
Okay. I wasn't told that you have to get every year, so that's why I didn't know.
I know, it's kind of awful.
Yeah. So, I mean, are you going to send a link for the HIPAA, or I can do it after the examiners, because a lot going on right now doing the new job and all that. So I was thinking I can do later or can't.
No, I would need for you to finish it. Well, it was supposed to be done by yesterday, but since there's some people who are still working on it, I would accept it all the way through tomorrow, because Guillermo is going to be sending out the certificates this week. And so I don't want to keep going, oh, I have to go back and check to see who took the test, and then sending him the scores, and then having him have to do more certificates when he's moved on. So that's kind of the problem, is that we kind of work on a schedule and then we can't keep going like, oh, let me go back and check to see if somebody turned in something over here, because it's really hard to keep track of 50 people that way.
Okay. And then I will. Okay. So you're going to send a link?
Yeah, you already have a link.
Okay. I'll check it out.
So check your email.
Yeah, I will. And also about the exam, I just questioned a chat, but it was a time exam, right? You mentioned, I think.
60 minutes.
And it will be in class on December 5th, right?
No, it will be just like the HIPAA exam. You will be given the exam via email, and you can take it at your convenience with either that day or the next day. It has to be completed by Sunday.
Oh, okay. Okay, so you have to do at home. Okay.
Mm-hmm.
Yeah.
Yes.
Okay. And there'll be like all kind of questions, like short answers and multiple choice and true and false and all those, right?
Yes. Yeah. Yes, exactly.
Okay. That's it then. And then I think I emailed you something about 28th of December, so you can check it out. I guess I have work to do that day, so I can.
Yeah, I did it. I saw that there was an email and it said absence 28th of December, but you know what? We will be, do you mean November?
What is it?
You mean
November? Oh yeah, I'm sorry. Yeah, it's November.
That's what I'm saying, because I was looking for an email from somebody else, and I saw that there was an email from you, and it said absence 28th of December, and I went, what? And then I just moved
Oh
on.
yeah. I meant to say November. I'm sorry.
That's fine. That's what I thought. All right, no worries. I will respond to your email.
Okay, not worry. Okay, thank you very much.
All right, thank you. Have a good weekend.
Thank you. Bye.
All right, I think that's everything. Thank you all. Thank you, Jennifer. Thank you.
There's not class that day.
November?
November
20th. It's a holiday.
Yeah.
Ina.
Oh, there is no class. Sorry. Yeah, there is no class. Yeah. I was like in the morning. Oh my God. Yeah. What's going on?
Yeah. No.
Thank you. Have a good
There's
weekend.
no class. Sorry. Thank you for reminding. Thank you.
All right.
Okay. Thank you. Bye.
Bye.